All right, well, good afternoon. It had been our plan this week to expand the eligibility at the TCF Center to more groups, but after having some conversation with our clergy leadership in the community and with our medical staff, we think we need to push right now to get our senior citizens vaccinated. The people in this community, 65 and up, are most at risk. And of the 1,800 members of our city that we've lost, more than 70% of them were over the age of 65. Let me tell you what's happening today. We've lost 16 of our neighbors in the last 2 weeks. 15 of the 16 are over the age of 65. These are our most vulnerable members. And the so-called B117 variant, the COVID variant that comes from Britain. You've seen that in the last few weeks it's been in the state of Michigan. Now there are first 2 cases of residents of the city of Detroit. We aren't seeing it spreading fast in the city of Detroit, I think largely because Detroiters are so committed to social distancing and the face masks. But every place else, this British variant has shown up. We've seen surges in infections and surges in hospitalizations, which means we know that our seniors are even more at risk now than they were 2 weeks ago. And here is the thing that we want to make it a point to get across. I don't believe there is another city in America where every single person over the age of 65 can dial the phone number right now, get an operator to answer the phone, and book your vaccine next week. That's the city of Detroit. That's what the Detroit Health Department is doing. And so when I see our seniors continuing to get sick, I see us continuing to lose them. These losses are unnecessary. If you dial the number, we will get you in next week. And so we've been talking to the community about what can we do more and more to make it easier for the seniors to get vaccines. Certainly, we're now over 40,000 vaccines to the TCF Center. They've gone beautifully. You've seen the stories. You've talked to people. People are having a great experience. So what's the next question? I don't have a car. And so starting today, you can get a ride to the TCF Center. $2 round trip. Pick you up at the house. They'll stay with you through the entire process, take you home. If you can't afford the $2, they'll waive the $2 and take you for free. Every single senior, whether you have a car, you can afford a car, you can get a ride, and all you have to do is call our phone number. If you need wheelchair access, when you call, you can tell them that and you'll have wheelchair access as well. So the same phone number that you call to make an appointment, when you're on the phone, just say, I don't have a car. And they will book your ride on that same phone call. You don't have to do anything else, and IntelliRide will come out and pick you up. So we want to make sure that those who feel that they're shut in, that they may have been forgotten, we haven't forgotten you. We now have the ability to give you personal service. It's eligible to Detroiters. So anybody who's eligible for a vaccine in Detroit, you're a resident of Detroit, you will get booked on a trip. We also want to take the vaccines more into the community. And so this Saturday, we're starting what we're calling Senior Saturdays. And with me today is Reverend Wendell Anthony from Fellowship Chapel and Bishop Edgar Vann from 2nd Ebenezer, who have agreed to host the first Senior Saturdays, and they're going to be doing them for the next 4 weeks. And so this is how it works. You can get your vaccine at the church in your area. So 1,000 seniors, the first 1,000 seniors who call, will get scheduled if you want. You can go call and be at TCF, or you can say, I want to go to 2nd Ebenezer. I want to go to Fellowship Chapel. I'm available on a Saturday. We're going to book 1,000 appointments for this Saturday, and we're going to do it the next 4 Saturdays. And so Fellowship Chapel's over on West Outer Drive, west of Southfield. 2nd Ebenezer on DeQuinder, near McNichols. You can book to either one of those, and it's going to be a little bit different. At TCF, you stay in your car and you drive all the way through. If you go to the churches, you'll park in the church parking lot, and you'll go inside the church, just like you would for a service, and you'll get your vaccine inside the church. So whichever you are more comfortable, when you call our phone number, you can just tell the operator what you would like. This is for our seniors. All the other groups, the teachers and the postal workers, those folks have to go to TCF, but we are trying to reach our most vulnerable in the places that are closest to you. We are going to continue to reach out to our seniors, and I have to ask the people of the city, you know somebody who's over 65, tell them how important this is. We're going to take 2,000 seniors who have already called Myers and booked an appointment. The city's taking 2,000 of our vaccines allocated. We're giving them to Myers. And this Friday, if you booked an appointment at Myers, you'll get a chance to come into the store. So we've got another location at both the Myers on Grand River and the Myers over on Woodward. I talked today with the officials at Henry Ford and DMC, and they are committed to expanding because here is our problem. 5% of Detroiters today have been vaccinated. 13% of the people of the state of Michigan have been vaccinated. We continue to lag, and the difference is that in the suburbs, 80% of all the vaccines are being done by the healthcare systems. In the city of Detroit, the Detroit Health Department is doing nearly all of it. And so I've talked to the leadership at Henry Ford and DMC. They are prepared, if they can get additional vaccine allocation, to open up community vaccine centers in Detroit. And I'm communicating now to both the governor and the president that Detroit, the city of Detroit's ready to go from 15,000 a week to 25,000 a week. The TCF Center couldn't be going any more smoothly. And so as fast as we get vaccines, we are going to keep ramping up until we eliminate that gap between the city and suburbs. The difference between the 5% in Detroit and the 13% in the suburbs is supply, and it's largely because the healthcare systems are having no trouble getting their supply out to suburban patients, and they now are in agreement with me. They got to ramp up on city patients. We will have more churches starting a week from Saturday, and so Dr. Iris Taylor, our director of nursing who's running this, is looking for centers right now. We'll have them in Southwest Detroit. We'll have them on the far east side, and if these senior Saturdays prove successful, and so far today, half the phone calls we've gotten from seniors have booked in to Bishop Vann and Reverend Anthony's church site. So it looks like it's going to be a popular way to go. We will open up more and more church sites in other parts of the city. And 1,500 seniors this week are going to get their vaccines right at their senior centers where they live. Denise Fair and her team are going to come in with their teams. I asked Dr. Rob Dunn to come speak for a minute about what's going on with the B117 British COVID variant, talk about how we need to be conscious of this. We can beat this thing, and the good news is the Moderna and Pfizer vaccines, all the research is showing, they'll beat the British variant. We just need to get vaccinated. And with that, I'll turn it over to Dr. Dunn.
Yeah, thank you, Mr. Mayor. I just want to talk briefly about the variant. I think we've mentioned some of this before, but it's important to understand that the issue with the variant is it's becoming more dominant in the U.S. The cases are growing. The CDC expects it to become the dominant variant of the disease over the next 6 weeks. What does that mean? What we know about it is that it's easier to catch. It's about 50% easier to catch than the variants that we've been living with here in this country. So it is so important for all of us to stay focused on everything that we've been doing, making sure we're masking, making sure we're staying focused on social distancing and hand washing. Getting tested. It's very important to get tested, especially if you've been traveling. This variant is all over the U.S. and it's certainly all over different parts of the world. And many of the cases that have been identified are identified in travelers. So if you've recently been traveling, please take advantage of one of the many opportunities to get tested. We have many opportunities in the city of Detroit and all over, but please get tested. If you're sick, get tested. If you're sick, don't come to work. Stay away from others and find out what is causing your illness. And if you're eligible, please get vaccinated. I cannot emphasize what the mayor is saying enough, that vaccination is an incredibly important part of this. In parts of the world that have been dealing with this variant for a while, that have had higher rates of vaccination, we have seen some decrease in cases, and that is really, really important to take home. This is if you have an opportunity to get vaccinated, please take advantage of it.
So when we went to look for partners for our first 2 senior Saturdays, We reached out to two folks who have very large churches, and the five of us all sitting in the front here have all been vaccinated ourselves. But to talk about the role that Fellowship Chapel is going to play, I'll turn it over to Reverend Anthony.
Thank you, Mayor, and let me thank you and the City of Detroit, the Health Department, and the state for providing this opportunity. I'm glad to be a part of saving lives and to join on the west side with my brother and friend and colleague on the east side, Reverend Dr. Bishop Edgar Vann. Mayor, as you've said, I have had the vaccine, so in the church we like to have witnesses, so I bear witness. I have had the vaccine. I'm good. It didn't cause me no pain, no headache. It didn't even hurt. And my wife had it, and so we're good. I think our second vaccination will be on the 22nd. We look forward to that, and maybe this time I'll be able to get it in my own church. And so we are pleased about it, and I encourage people to participate. And I think there are two reasons predominantly why African Americans and other minorities may have not had taken advantage of it. One is the historic reasons surrounding the administration of vaccines and health care in the African American community, and the other is access. I think one of the things we've done today is to kind of close the gap on access, particularly as we bring stuff into the neighborhood. And Mayor, if I can just take a minute, I just want to dispel some notions around the historic reasoning for that, for hesitancy in African American communities around this issue. Before I came down here today, I was talking to my facilities manager, and I did not know, and I thought he knew better, how hesitant he was about taking the vaccine. We had a conversation, and she started telling me, Rev, I mean, I know you, I trust you and you're good, but I just ain't got, I can't do it. And then we started talking about historic reasons, and we started talking about the reasons. He began to understand. The first thing you might want to say to my African-American brothers and sisters is that the vaccine you are going to be taking was developed by an African-American woman, and that is just a fact. Those are the words of Dr. Anthony Fauci, the leading epidemiologist on the issue of viral diseases, as well as the director of the National Institute of Allergies and Infectious Diseases. He went on to say that it was actually developed by my institute's Vaccine Research Center, a team of scientists led by Dr. Barney Graham and his close colleague, Dr. Kizzmekia Corbett, or Kizzy Corbett, the head of the National Institute of Health, his close colleague, an African-American woman, one of the leading scientists for the coronavirus research. I want to put that out there so people understand it. Currently, less than 6% of African Americans nationwide have been vaccinated. That needs to change. And that goes back to Tuskegee and other situations. It's also important to point out that Tuskegee was about the vaccinations that we did not get. We did not get the antidotes to syphilis and to other diseases historically. We are getting the antidote to this disease. As we approach nearly 500,000 deaths, it's important to hear these names. Dr. Reed Tucson, founder of the DC-based Black Coalition Against COVID-19. Dr. Gary Gibbons, director of the National Heart, Lung, and Blood Institute for the National Institute of Health. Dr. Marcella Nunez Smith, Associate Dean for Health Equity Research at the Yale School of Medicine. Dr. Lois Pace, Executive Director and President of the Global Health Council. Nurse Jane Hopkins, specializing in mental health more than 20 years as a bedside nurse, and in Seattle, Washington, among the many African-American men and women, both engaged in the research, development, counseling to the President of the United States, and they're the ones that's pushing and behind this vaccine. And in our own state of Michigan, lest we forget, Dr. Jonay S. Caldoun, the Chief Medical Executive and Chief Deputy Director for Health and Human Services. These people ain't trying to take you out, they're trying to keep you in the game of life. And so I'm very excited about the opportunity to have these at the churches. Our church will be open this Saturday from 9 until 1. Register online. We urge everybody to come and to get vaccinated, not only to save your life, but perhaps save the lives of many others. In the words of Dr. Kizzmekia Corbett, a lot of people are banking on us or feel we have a product that could at least be a part of the answer that this world needs. I want to live and I hope you do too. See you at the Vaccine Center.
Amen. And in the theme of bearing witness, I turned on Facebook one day, and I bore witness to Bishop Edgar Vann getting his vaccine. Bishop, you've been a great leader, and we're glad you're hosting our seniors on Saturday.
Thank you so much, Mr. Mayor, and to my esteemed colleague and friend, Reverend Anthony, from the west side.
Bless you.
I'm from the east side.
All right.
To the City Health Department, its leadership that's represented here, and to all of you. This is an exciting day. It's exciting because we get an opportunity to use our influence and our leadership toward getting people vaccinated, most especially seniors who need to be vaccinated. We have a lot of reasons for vaccine hesitancy. Reverend Anthony's talked about a few of them. And there are others who say, I have certain conditions, I have medications that I take, I'm compromised in some way. Well, let me just tell you, I have chronic conditions. I am immune compromised. I have also several comorbidities, and I took the vaccine along with my wonderful wife, and we are doing just fine. We want to put a stop to this COVID crisis and chaos that has taken our community by storm. 3.5 times more of the deaths occur in the African American community. It's our opportunity and our privilege to open up our churches along with the other partners that have been outlined today to make sure that there is no excuse. You'll have access. You can call that hotline right now. They're going to talk about the telephone number. You can say that you want to go to Fellowship Chapel, you want to come to Second Ebenezer. Second Ebenezer is ready, and we're able to accommodate you, as we always do, for all of the community outreach that we do. I want to thank you, Mr. Mayor, for this opportunity. I want to thank you for recognizing the power and the influence of the church and how it can assist you and the city and our residents during this time. It's so important. Please, you can come to Second Ebenezer this Saturday, 1 to 6. Now, you have to have the appointment, 1 to 6, and then after that, I think it's going to be from 9 to 1. But get vaccinated. Let's put this behind us. Let's get out in front of the variants that are out there, and let's live.
Well, thank you. Dee Prosy, our great ad director, is in the process of making TV ads by interviewing the very happy seniors who are being vaccinated at the TCF Center as they drive off. But she just texted me to indicate she'd like to add ads from the two of you onto our social media page. But it's very, very powerful. So thank you. And now the great health director whose team is in our senior centers day and night right now, and will be vaccinating 1,500 seniors this week, Denise Fair.
Thank you, Mr. Mayor. Most people don't know this, but I am a PK. I'm a preacher's kid. So it's so good for the Reverend and the Bishop to be here, and amen to both of your presentations. So let me share with you that the Health Department is continuing to provide outreach to our most vulnerable. That's our seniors and people who are experiencing homelessness. To date, we have vaccinated over 2,100 staff and residents, 1,300 staff and residents at 22 senior apartments, and 826 staff and residents at 18 homeless shelters. And so the work is still continuing. This week for our homeless shelters, we are going to 5 locations: St. John's, the Michigan's Veterans Foundation, the YWCA, the Community Social Services of Wayne, and the Mariners Inn. For our senior apartments, we're going to 18 locations. So we've beefed up our teams. I think we have at least 4 to 5 teams every day. We're going to Harriet Tubman Apartments, Orchestra Place, Dickerson Manor, Envision Center, River Towers, Wellington 1 and 2. So we'll leave these locations up here, but it's really important. The city of Detroit, the health department, we are putting our seniors, our most vulnerable, first. And the outreach is a critical component to our city's effort to stop the spread. So not just slow the spread, but we are going to stop the spread right here in the city. Now, we also rely on our science and data to drive our decision-making on where and how we're allocating our resources to ensure there's an equitable access for all. And I believe the Reverend spoke on this briefly. But in Detroit, Mayor Duggan has said numerous times before that any Detroiter who wants to get vaccinated can get vaccinated at the appropriate time. Also, public health can only move in the spirit of trust. And as we rely on our trusted community partners, such as our faith leaders, they will help us to get to those who are our most vulnerable. And so, as the mayor mentioned, part of our efforts is to get more seniors vaccinated. So I encourage every Detroiter who's 65 years and older to attend the Saturday senior clinics for the next 4 Saturdays at the Second Ebenezer and also the Fellowship Chapel. Again, this is just another way that we can ensure equitable access to the vaccine. So as your health officer, I want to empower you with enough information and education so that you are confident to make the best decision to get vaccinated. And I encourage everyone to visit our website, to go there now to detroitmi.gov/health to learn more about the vaccine. As the Reverend and Bishop indicated, that Black and brown communities are disproportionately affected by COVID. And if you look at our dashboard right now on our website, you will see for yourself that Black and brown communities are 2 to 3 times more likely to get COVID and also to die from it. So it's really important that you take the time, go online to our website, get more information so that you can make the best decision for yourself. And finally, as Dr. Dunn mentioned, there are now 2 cases of the variant here in Detroit, so it is vitally important that you follow those safety precautions of wearing the mask, maintaining social distancing, avoid crowds, wash hands, and get your vaccine at the appropriate time. And even if you've already had 2 doses of the vaccine, continue to follow these safety precautions so that we can continue to beat COVID-19. And with that, I'll turn it back over to the mayor.
Okay, we're going to have a second piece of this in which we're going to talk about the Paycheck Protection Program. But John, I think we should wrap this up first. So for businesses out there who want to know how to access PPP, which is open to March 31st, we're going to show you those details in just a minute, but I don't want to lose Bishop Vann and Reverend Anthony. So right now we'll take any questions related to the senior expansion on COVID, and then we'll go on to our business program.
All right, a few questions from Annalise from Cranes. What is the price and length of the contract offering transportation to TCF?
We can get you that. Hakeem Berry is the guy who knows that, and right now he's over at TCF running a line. But we can get you the answer on that.
All right.
It was bid and awarded this week.
City Council today is considering a $3 million contract with a pharmacy company to staff the TCF Center Vaccination Center. Who made up the staff before and why the change?
You know, we're going to have to get Hakeem Berry to answer those questions. So he is running all of that stuff, and I didn't realize operational questions at TCF were what was here.
Any sense of specific areas or communities where we're seeing need support in terms of mass transportation to the sites? Specific communities that might
Again,
need?
at this point, it doesn't matter. We're going to pick you up wherever you are.
Okay.
And we'll go to your home, we're going to pick you up, we're going to get you vaccinated, we're going to drop you back off at your door.
All right.
Any other questions?
Let's see. What is that one?
This is from Corey Williams from the Associated Press. Wanted to find out if we know what the infection rate is for Detroit compared to what it was previously earlier in COVID and what it is compared to surrounding areas.
And you can look on the state's website right now. When I looked last Friday, Detroit was in the 3% range. The surrounding communities were in the 4 and 5% range. But the state updates it every day on the My Start Safe Map, and you can look it up for yourself.
Okay, and Corey, sorry, this is from Christina Hall from the Free Press, wants to know what the city is seeing in terms of COVID-19 cases and deaths in the city's nursing homes since vaccines have started to be administered.
Our nursing home deaths have been very low. What have you got?
Yeah, they have been very low, and actually, we're focusing our efforts on the vaccination. We have already vaccinated with the CVS and Walgreens. They have vaccinated 50% of all of the senior apartments, or excuse me, the senior centers on their second round. So they're doing really well. I can give you the death numbers, but again, they've been really low.
Yeah, even before that, we were regularly testing the nursing homes, and so we've had an extremely low death rate in nursing homes for several months. And I don't know if the 16 in the last 2 weeks, whether any of them were nursing home patients or not, we can get you that answer, but the nursing home leadership is doing a good job.
Okay, and one more question from Christina Hall, wanting to know if the city is vaccinating residents at assisted living locations or just senior citizen buildings.
We are. So there are, I believe, 25 senior living facilities in the city of Detroit. And of those 25, 24 of them have been signed up under CVS and Walgreens. And so the health department has only vaccinated one location, which was Boulevard Manor, about 3 or 4 weeks ago.
Right, so the federal government distributed the vaccines through CVS and Walgreens for those, and we have supplemented any place that wasn't otherwise covered. But we've been to all of them that haven't been covered.
Okay. Has the city identified, whoops, I think we might have already asked that one. Okay, I think that's all the questions for right now. If we have more, we will bring them up.
All right. Well, thank you very much for our partners.
Thank you very much, Mr.
Thank you, Mayor.
Guy Bowman.
Okay, so businesses that partner with the paperwork and all that, are you the guy?
He's about to, if you want to stay 5 minutes, you're going to hear the whole story.
Exactly where this should go. Okay, yeah, because I do want to know.
So I'm joined by Kai Bowman, who runs Detroit Means Business, and Reverend Anthony will answer your question of how everybody can get business support. We are committed to keeping all of our businesses open for another few months until I think we're going to finally see the kind of life that we wanted. And Danielle North, who runs a business called Kids Kingdom in the west side of Detroit. Okay. Last spring and summer, one of the most effective things the federal government did was the Paycheck Protection Program. And every business that participated knows how it worked. The federal government reimbursed you if you kept your employees on the payroll. It kept companies afloat, and it kept people with paychecks coming. They have now opened up PPP Volume 2. And you can go to DetroitMeansBusiness.org, and Kai Bowman and his team will take you through the process if you need any help. These are forgivable loans that are forgiven if you keep your staff on the job. Round 2 focuses primarily on women and minority-owned businesses in low-income neighborhoods, and there are loans of up to $2 million available and 1% interest paid back over 30 years. And they can be forgiven if you keep your members employed. That's the simple program. Go to DetroitMeansBusiness.org, and they will help you through. And with that, I'm going to turn it over to the man that's running this operation and doing a great job, Kai Bowman.
Thanks, Mayor. So as the mayor said, we're in a crunch right now. What we know is from the first round of PPP, there was roughly $647 million in loans that were made to businesses here in the city of Detroit, which impacted 5,412 Detroit businesses. What we see for this second round, which launched on January 11th, is that we're trending lower this time around. And so we want to make sure, kind of putting out the signal to all Detroit-based businesses that the second bucket of money is available. There was roughly about $284 billion that was allocated to the Paycheck Protection Program. And so this is really a call for our Detroit businesses to get in and apply, whether it was whether you were successful the first time in getting a PPP or you opted out of trying to apply for the PPP. We want to make sure that that you are taking advantage of it this time around. So for round two, whether you receive the funds or not, for first draw eligibility, you need to have not received a loan the first go-around and be a small business with less than 500 employees or a sole proprietor. You also need to have been in operation by February 15th of 2020 and have a tax ID. For second draw eligible folks, you would have received a loan the first round, and in all likelihood, you would have been contacted by the financial institution who granted your first loan to apply for it. What we're really encouraging and what we're seeing is that the second draw eligibility folks are having a better and even easier shot this time around to take advantage of those funds. For second draw eligibility, you need to have a small business with less than 300 employees or be a sole proprietor. You also need to have been in operation from February 15th of 2020 and have a tax ID. A couple of other stipulations. You need to be able to demonstrate a loss of 25% from any quarter in 2020 versus 2019. And so you can decide what that quarter is, but you need to be able to demonstrate that loss. The last stipulation is that the funds that you receive from round one need to have been spent down. So you need to make sure that those have been exhausted. One of the myths that we want to do away with is that you do not need to have had your first round loan forgiven prior to applying for round two. So you can apply for a second loan. The documentation that you'll need, so this is the feedback that we've been receiving, is that the PPP loan application seems to be, very cumbersome. The reality is that the feds have made the second round application a little bit easier, but here's the documentation that's required. So banks will need your business and personal tax returns for the last 1 to 3 years. You'll need to show your 2020 interim financial statements. You'll need payroll information. So IRS forms 940, 941, a W-3, and/or detailed payroll summary report. And then you'll also need to be able to show, if you are a brick and mortar, a property mortgage statement, lease agreement, or property utility bills. And so for those businesses that who need support with getting the documentation that they need, we have resources available via DetroitMeansBusiness.org. When you click on the Payroll Protection Program support area, you'll be able to sign up for that support that you need to help you gather those documents. So we have a group of trained MBA students, our MBA response group, that will be able to help with the application and walk you through that process. For the documentation that you need, we have accounting students from the University of Michigan who are volunteering, providing that consultation services via telephone, Zoom, or Google Hangouts to get people the documentation that they need. We also have a coalition of folks who are helping out within this Detroit Means Business ecosystem to support around loan forgiveness. And so for a lot of those folks that received the loan the first time, and many of the financial institutions have not began to open up around loan forgiveness. They have not provided the links as of yet, but those are coming. So I know there's a lot of apprehension around, taking on more debt and more loans, but the reality is that these loans, providing you spend them on the proper expenses, these loans will be converted to forgivable. They will become forgivable, which really this is the easiest way to get capital for small businesses. Many businesses are looking for grant opportunities. Those grant opportunities are few and far between, and it becomes very competitive to get those. So what we're seeing right now with the Paycheck Protection Program, this is by far the easiest, and as the mayor said, the best tool that the feds put together last year to help support our small businesses. As we said before, the applications are open until March 31st. please do not wait until March 31st to submit your application. We want to get you in there and get you time-stamped with the SBA way in advance before that March 31st deadline. What I've done today is brought along Danielle, who runs Kids Kingdom, and she's had the opportunity to, was able to be granted her first round paycheck protection support, and then she's also applied for her second go-around. So I'll toss to Danielle and allow her to talk through her experience.
Thanks, Kai, and thanks, Mayor Duggan, for the opportunity to share my experience. I am Danielle North. I am the owner of Kids Kingdom Child Care and Party Center. We are the first and only indoor playground in the city of Detroit, and we've been a licensed daycare since 2017. We're coming up on 5 years, actually, of being open. And as you can imagine, being a very small business, it was pretty difficult to go through the pandemic as we're still struggling through. And last year, when all of the notifications were going around about PPP, I was very apprehensive, and I really wasn't in a rush because I was dealing with a ton of things. My other business that I run, my husband, my children, trying to navigate having them at home. And as business owners were getting disappointed because that first round was pretty chaotic, I was kind of relieved that I didn't apply in the beginning. We were shut down for 3 months last year. We were shut down April, May, and June of last year. And as I was deciding if we were going to come back, I knew that I needed the funds in order for us to even reopen. And so I've been a member of the Detroit Means Business Stakeholder Advisory Group since last year, and it has been really very beneficial for me to talk with other small business owners who are trying to navigate, COVID and navigate being a business owner in these difficult times. And so the feedback that I was receiving from the other business owners was that PPP is something that you just do not want to pass up. It's a wonderful opportunity. At the end of the day, if for some reason you don't meet the forgiveness requirements, it's only a 1% interest rate. And, for good and bad, I've had to take out many loans throughout the life of my business ownership, and not a single one has been at 1%, nothing close to it. And so that risk there is much lower. And so after receiving some of that feedback, hearing, directly from business owners like me who went through it and it worked for them, and at this point, the guidelines had changed. So they gave you 24 weeks, and the amount of utilities and rent that you could use with the funds was balanced out a little more because I did lose some staff during COVID. And so I did go ahead and apply, and like Kai stated, it is not as difficult. They do require some documents, and I think what hangs up some business owners is that you do have to have those documents in place. So I was happy to hear that you guys are providing resources for business owners who may not have those documents readily accessible or may not be aware of how to access those documents, but those documents are required. It was pretty straightforward for me. Within less than a week or so, I had actually received the funds deposited into my account. And it was really, really beneficial for us. And because I did wait later, our 24 weeks came over into the start of this year. And so one of the other myths out there is that you need to have your forgiveness completed before you apply for round two. The bank has to initiate that process with you, and because a lot of the rules and guidelines are still changing, a lot of banks aren't even going forward yet. And so I haven't started the second process, but the bank reached out to me to go forward. I haven't started the forgiveness process, but they reached out to me to apply again, and which I have done. And as we're still trying to navigate and figure out how to stay open through this pandemic, I know that this will be beneficial, and I'm 100% positive that I will be forgiven for the first portion because I use the funds according to the guidelines. So I encourage small business owners to apply, or at least reach out, check out the DetroitMeansBusiness.org website to get the assistance that you need to see if you qualify, and if you do qualify, get the support you need to go ahead and apply.
I know the children in Northwest Detroit are glad to hear Kids Kingdom is going to be around and open. And so, John, if there are any more questions relative to business, we'll take them.
Yeah, just one question, that is whether or not as part of the overall PPP program, is there a certain amount that is available to Detroit businesses, or is it driven more so by how many businesses apply?
It's great question, John. It is driven by the number of businesses that apply. As I said before, there was $647 million that was loaned out during the last tranche of money. And so this go around, we're looking to get $1 billion to the city of Detroit, but we need businesses to actually apply. The banks are ready. We have the technical assistance providers ready to provide that support. We're looking to bring in as much money as possible into the city of Detroit.
Okay, that was the last
All
question.
right, thank you very much.